Hi, everyone. Thanks for joining us this evening for an update and answers to questions about veterinary practice during the COVID-19 pandemic. I'm Laura Hungerford from Population Health Sciences at the Virginia, Maryland College of Veterinary Medicine. I'll be serving as the moderator tonight. A recording of this live question and answer session and the slides with links will be available for later review on the same website where you've accessed it originally. Our panelists tonight are from the Virginia Department of Health, Julie Murphy, State Public Health Veterinarian, and Brandy Darby, Veterinary Epidemiologist. Aside from myself, also from the Virginia, Maryland College of Veterinary Medicine, are Cassidy Rist and Jenny Zambrisky from Population Health Sciences, Tanya Leroy from Biomedical Sciences and Pathobiology, and Trish Hawk from Veterinary Social Work. From the Virginia Department of Agriculture and Consumer Sciences, from the Virginia Department of Agriculture and Consumer Services, Carolyn Bissett, Program Manager from the Office of Veterinary Services. From the Virginia Veterinary Medical Association, Jay Margolis, VVMA President. From the Maryland Department of Agriculture, Michael Odian, the Chief State Veterinarian. From the Maryland Department of Natural Resources, Cindy Driscoll, State Fish and Wildlife Veterinarian. From the Maryland Veterinary Medical Association, Elizabeth Cottrell, MD VMA President. From DC Health, Nivedita Ravi Caldwell, the Zoonotic Disease Epidemiologist, and Vito Del Vento, Executive Director and State Veterinarian. First, thank you to those of you that sent in questions to our survey. Our panelists were able to incorporate many of them in the presentation. Please share additional questions by entering them into the chat area of YouTube as we'll be monitoring this. If you're watching from the VMCVM website, you can access YouTube by clicking on the icon in the lower right corner, which will take you to YouTube.
Okay, great. So hopefully everyone can hear me all right. I wanted to, as Laura said, I wanted to thank everyone who submitted your questions in advance. I was able to compile all of the questions submitted by Monday afternoon and give them to our presenters so that they could really guide the content of this webinar in an effort to make sure that it's really useful to you. I did add the additional questions that were submitted since that time, and we're going to make sure that we have time at the end of the webinar in the Q&A session to address some of these remaining questions, as well as any new ones that are posed in the chat. So as far as the general questions that folks had, the major themes were presented here. Around veterinary practice. So a lot of folks had issues or concerns around liability, continuing education, telemedicine, where they could find support or resources for staff, and we certainly are going to get to some of those. Practice protocols, specifically euthanasia was a hot topic, as well as curbside service. So when to resume it, you know, how to do that safely. And then we had a number of folks, we heard you out there, that had some ambulatory specific questions related to protocols. Questions also came in that were animal specific, so specific to testing, zoonotic transmission. We know that information is sort of unfolding every day with new positive tests that are being confirmed in animals, and we want to know how, or you all want to know how that translates into what you should be doing in practice. And then probably the biggest area of questions was around employee health and safety. So thinking about as the states open up, what are there any changes in PPE requirements for staff, and what are some of the workplace employee guidance for exposure and testing that were some of the questions that you guys had. And then finally, there were definitely some questions around PPE shortages. For sure, I think most of these questions will be addressed through the webinar, but again, those that are not, we'll hope to get through in the Q&A session. And then of course, there are some of these that weren't specifically relevant to this particular presentation, but we are getting them into the hands of those people who might be able to understand what questions are out there and then hopefully get the information to you. Next slide. So as far as the survey results, you guys are a great group. We had a total of 271 people responding to the survey itself. That's not just asking questions, but that's going through the survey. Most of you are from Virginia, or practiced or worked in Virginia, but many in Maryland, a few in DC, and then there were other states that were represented as well. Primarily veterinarians responding, but we did have a lot of vet techs, nurses responding, and then other staff like hospital directors that were interested in responding to the survey as well. So we thank you all. Small animal is the primary practice type represented here, as you can see. And then the other category at 12%, sort of a lot of people self-identified or didn't self-identify here. So this included emergency medicine, equine only, those who did relief work in different practices. So we had quite a variety, but obviously small animal practice was primarily represented in the survey results. Next slide. So as far as current services, and I guess I should have started out with one of the reasons we wanted to show you these results is we think one of the things that makes this valuable is it's an opportunity for everyone to sort of see what's going on in the minds of other practicing veterinarians out there. What are the challenges? Are you experiencing challenges that are similar to others? So hopefully this really brief summary will give you some insight into that. So currently about 75% of those responding are in practices that either did not stop essential services or are or have already resumed those non-essential services, with 20% open and planning to resume non-essential services in the next 1 to 2 weeks. So we know that here coming up, probably the majority of practices are going to be trying to do what they have always done, but still within trying to think about how they can do deliver those services safely. Next. So when we asked you all about some of the specific concerns you had with the state reopening and some of the challenges that you were faced with, major themes, probably the biggest one is asking how to move from curbside service, not just how, but when you should move from curbside service to in-clinic service and how to do that safely. A lot of questions about that. Also this idea that staff and clients sort of linking reopening with meaning everything is back to normal. So a lot of you are seeing more walk-in clients, people just showing up at your clinic. Some made a note of that clients were actually assuming or demanding that they could come into the building. And obviously that posing challenges if that's not in line with what your practice was currently doing. And then there were a number of you who responded about having concerns about differing sort of perceptions of risk within the staff, and some staff sort of following what you felt were acceptable guidelines and others not. And so obviously all of those things lead to feelings of stress and fatigue. A lot of people mentioned having all of the challenges that they faced with continuing curbside service, the extra time that took, and recognizing that the increase in volume there was going to be an increase in volume of people coming to the clinic. How do you do that? And again, balance that safety for both the public and your staff and personnel. So a lot of questions around this. Hopefully most of these will be answered in the webinar. Next. So as far as PPE shortages, although 20% have not been experiencing any issues with PPE shortages, you can see here that a lot of people have, particularly with surgical masks, but gloves, both non-sterile and sterile, as well as disposable gowns and face shields. And there's a whole section talking about things to do to find out more about these shortages. For those who were experiencing PPE shortages, 44% felt that this was going to impact your ability to work and provide non-essential services, as well as 57% felt that these PPE shortages were going to impact the ability to work safety. So obviously this is an area that many practicing veterinarians and staff have concerns about. Next. So this relates to in your practice, if you've experienced any challenges with employees returning to work after illness related to COVID-19. Only about 12% of those surveyed said that they had had actual experience with this. But a number of those, I think it was around 30%, if I recall, still had questions about this. So even if a smaller percentage of people are experiencing this currently, there is concern going forward, thinking about how to address this if this does occur in the workplace. And again, this is going to be a topic that is addressed pretty heavily in this webinar. Next. Animal testing. So as more and more information comes out, we were curious about how often you all were being asked about testing by clients for their pets. 25% say rarely, 65% say no, not at all. And it's really only a small percentage, about 5%, that feel like clients are calling more than 1 or 2 times a week and inquiring about testing in their pets.
And with that, thank you, Dr. Rist. We'll move on to Dr. Brandy Darby, who will give us an overview of COVID and where we stand and start making some updates to help us in this area.
All right, thanks, Dr. Hungerford. I wanted to start by providing a quick situational update on COVID-19. Currently, we have over 1.5 million cases reported in the United States and over 93,000 deaths. Next slide. Regionally, states have been sharing dashboards showing the impact of COVID-19 in their areas, and the websites where you can go to see these dashboards are listed on this slide. In Virginia, you can choose whether you want to view either the total number of cases reported in your health district or the rate of cases per 100,000 population. As you can see, there's increased community transmission across most of the Commonwealth. In DC, there's widespread community transmission with the highest rates of transmission in Ward 4 and Wards 2 and 3 having the lowest rates of transmission. Next slide. In Virginia, at least, and perhaps in some other areas as well, we've seen our case counts go up over time and then stabilize. And in some areas, these cases are starting to decrease, thanks at least in part to the social distancing measures we've all been participating in. In the data presented here and on our VDH website, the dark blue represents PCR confirmed cases, and the light blue are probable cases, meaning symptomatic persons who were in close contact with a known case. The event date at the bottom might represent illness onset, hospitalization, or death, depending on how the case was first reported to the health department. The yellow line shows a rolling 7-day average to help us appreciate case trends over time. And this is an example of the type of data that we're looking at to guide various reopening strategies. Next slide. I also thought it'd be nice to share with everyone an overview of various aspects of the COVID-19 response that veterinarians have been involved with. Many of us have been pulled in to help respond to outbreaks occurring in meat and poultry processing plants in our regions. On this slide, my slide changed. I don't know if that changed for everyone, but on the slide there, it showed an epi curve with COVID-19 in a Virginia community. The bars in blue represented community transmission cases that were then impacting poultry plant workers and then brought into the plant. And then you can see how quickly the cases amplified within that poultry plant setting. And so we've been involved with helping with the outbreak investigation and response efforts there. And as you might imagine, the working conditions in these facilities are not totally unlike those in a veterinary facility, in that by the nature of the workplace, social distancing efforts can be somewhat challenging. We've also been utilizing a One Health approach to better understand COVID-19 in animals, including in pets and in wildlife, and we'll hear more about that in just a little bit. And then we've also been involved with developing plans for reopening states and businesses, including best practices for veterinary facilities, to keep everyone as safe as possible as we begin to reopen. And we'll be sharing some more of this information with everyone this evening. Next slide. So the last time we were together, we shared some prevention strategies with veterinarians that centered around ways to decrease the number of people that one would come into contact with on any given day. And these included things that we've mentioned, such as curbside services, social distancing efforts, prioritizing the provision of veterinary services for sick animals. I just wanted to share the link with everyone in case you weren't able to join us for our previous webinar, that there is a recording that's available at the link on this slide. Next. So then as we've gone through this outbreak and learned a lot more about SARS-CoV-2, we've had a lot more guidance come out that's helpful to us. For those of you who've not seen some of these resources as yet, the CDC came out with interim guidance for veterinarians that's available, and it is geared predominantly towards small animal practice. And then in addition to supplement that guidance, a lot of states have put out regional guidance for veterinarians, and you can access this by going to the VDH website and looking at the resources for veterinarians under our health professionals tab. We do go through and update that information regularly, so that's a great place to check for information for Virginia veterinarians. Likewise, in DC, they've got similar information available on their website under the resources tab, and they're also updating that frequently. Other things that have changed since we were last together, the CDC and the US Surgeon General came out with a recommendation that people wear cloth face coverings when in public, especially when in settings where social distancing is difficult, and with emphasis, especially when in areas with significant community transmission. As this virus is spread predominantly through respiratory droplets, the face covering helps to decrease transmission from a person into the environment. I also wanted to point out the critical infrastructure workforce guidance. Veterinarians are included as part of this guidance under the food and agriculture sector. And as part of this guidance, it's recommended that those who are exposed to a case of COVID-19 quarantine themselves for a period of time. However, if that person's absence from the workforce would have a negative impact on the ability of critical infrastructure to continue operations, those exposed workers can continue to work if they remain asymptomatic and follow additional precautions as outlined in the guidance. I also wanted to talk a little bit more about recommendations for discontinuation of home isolation, as those recommendations have evolved over time as we've learned more about this virus. Next slide. I just quickly wanted to clarify some of the terminology we use in public health so that we're all speaking the same language. Firstly, for quarantine is the separation of people who were exposed or potentially exposed to COVID-19 from others. And so this typically applies to healthy people. So what we would define as an exposure to COVID-19 is having close contact, being within 6 feet for at least 10 minutes of time with a confirmed or suspected case of COVID-19, or being a household contact of a case. And we recognize the potential for pre-symptomatic transmission to occur. And therefore, when we're looking at that exposure period, it would also include the period of time of 48 hours preceding illness onset in that individual. So we would include that 48 hours in our definition of potential exposure. And then for isolation, that's a separation of people with COVID-19, so people who are sick from others, and there are guidance available on the website. We recommend that people, if they're able to, stay home and rest for isolation, that's preferable. And for those who are ill and need to seek medical care, to call ahead to their healthcare provider so that they can be quickly triaged. And additional information is available on the CDC website as well as on our state health websites. Next slide. Lastly, I wanted to touch on the return to work criteria. both for those who were recommended to quarantine due to a COVID exposure and for those who have experienced illness. Starting with those who've been recommended to quarantine, the incubation period, or the time between virus exposure and illness onset, typically ranges between 2 to 14 days, with most people becoming ill 5 to 6 days after an exposure. For this reason, people who are recommended to quarantine due to an exposure should quarantine for 14 days from the time of their last exposure. And for most people, that's pretty straightforward. For those who are assessed as being exposed due to being a household contact, we recognize that there's going to be an ongoing exposure for that person. And so their 14-day quarantine period would begin from the time when the case that they've been associated with is released from home isolation. For people who were ill with COVID-19, the CDC outlines 2 different strategies for discontinuation of isolation. Now, there's a symptom-based strategy and a test-based strategy. And if you've been watching the news, you've probably seen instances where some people can persistently test positive after becoming ill. However, from conversations with the CDC, they've shared with us that they have a much harder time isolating live virus from people greater than 9 days out from that initial first positive test. Therefore, at VDH, we feel very comfortable recommending the use of a symptom-based strategy for discontinuation of isolation. With a symptom-based strategy, we want that person to be feeling pretty good. They have an improvement in all of their symptoms of illness for at least 72 hours without the use of any fever-reducing medication. And they're showing improvements with any other signs of illness that they've been experiencing. And in addition to that, it's been at least 10 days since symptoms first appeared. For everyone's awareness, there is also a time-based strategy that can be utilized for those who maybe have tested positive but never experienced illness. And there are details about that strategy on the CDC website. And also, I think it's important that, COVID-19 is not the only reason that an employee might be ill and out of work. And so if we find ourselves in a situation where someone is absent from work due to illness, but we have an alternate diagnosis from a healthcare provider, then the return to work strategies for that person should be guided by recommendations from their healthcare professional. And with that, I'll turn it over to Dr. Julia Murphy.
Thanks, Brandy. Can everybody hear me? All right. Well, thank you all again for joining and coming together as we walk through this difficult time, and thank you for all we know you're doing to help keep your yourself, your staff, and your clients healthy as you do the important work of keeping animals healthy. And Virginia's governor, the first few slides I have they're kind of specific to Virginia, but I imagine there are basic themes that our colleagues from DC and Maryland would echo, and anxious to hear from them about what they're doing there. Virginia's governor recently announced what he calls the Forward Virginia Plan for a first step into reopening certain businesses or certain aspects of businesses. This plan applies to much of Virginia. However, due to concerns about the level of SARS-CoV-2 activity in certain areas such as Northern Virginia, some parts of the Commonwealth will remain in the initial phase. The language of Executive Order 61, which I allude to there on the slide, that's the executive order that speaks to this initial step of reopening. And that executive order specifically mentions certain businesses, including restaurants and farmers markets, non-essential brick and mortar businesses and fitness centers, as well as places of worship. And it contains, as you see there, basic themes and directives around things like limiting occupancy, employee mask use, and also cleaning and disinfection measures that are to be implemented to help decrease transmission as we take this initial step to see if we can open back up. Have the next slide, please. There we go. Executive Order 61 and Executive Order 62, which is the executive order that directs certain areas of Virginia to remain in phase 0 for now, contain the language that's featured on the slide here. Veterinary hospitals are really not mentioned specifically in these executive orders, so I just wanted to kind of mention that. But the language around businesses offering professional services is applicable, and the broad language which instructs these types of businesses to incorporate social distancing and enhance cleaning practices are echoed in the directives for other businesses mentioned more specifically in the orders. In addition to that, the Forward Virginia guidelines for all business sectors indicate that where social distancing is not possible due to the nature of the work, employees should wear face coverings, and then it references CDC's best practice guidance on mask use. So we know there are many different types of veterinary practices, and they're varied in regard to the physical makeup of the hospital, the number and types of staff you have, and other aspects of practice. So we hope that some of the new guidelines that have come out from CDC and other information that we share tonight might be helpful to you as you implement these practices in your hospitals. Next slide. I thought I'd start off talking about some practices that might be helpful in veterinary facilities by first just starting kind of general with a general framework for discussion and consideration. I wanted to mention the concept of hierarchy of controls, and that's the term that some may be familiar with. It's often used in occupational health as a means of determining how to implement feasible and effective control solutions in the workplace. I think the biggest takeaway from all of this on this slide is that the best way to prevent disease transmission is to use a combination of interventions from across the hierarchy of controls. So if you use a combination of interventions when you can, that becomes a force multiplier within your practice to prevent transmission. This results in a greater degree of protection. So using multiple measures results in a greater degree of protection than any single method and provides backup in the event that one control intervention fails or some becomes less effective or perhaps even unavailable. Now, to be fair, when you look at the triangle there, the strategies of elimination and substitution they're not typically options in the veterinary setting. However, engineering and administrative controls and PPE can often be used to reduce or avoid exposures to transmissible pathogens in veterinary facilities. So examples of engineering types of control would include things like rearranging workstations to help with social distancing when people are, say, working on computers or doing administrative work. Touchless soap dispensers, rearranging break rooms, or having people go outside for breaks or lunch. Examples of administrative controls would include things like having in-person meetings only when needed and keeping the number of people to a minimum, assigning a COVID-19 coordinator who can remind people of infection control measures and be a point person for questions about COVID-19 and changing guidance within the workplace, staggering break times, leave and incentive policies to encourage desired behavior like reporting illness, cohorting staff, and highlighting educational materials that staff should be aware of. You see here on this hierarchy of controls, PPE, while important, and I don't want to discount the importance of it, is considered only one part in a range of infection control measures. And within the hierarchy of controls, as you see here, it's actually the lowest as far as effectiveness as compared to other measures. Next slide. We know the greatest risk of COVID-19 exposure to veterinarians and their teams and the public comes from person-to-person contact. So by extension, Staff should not come to work if sick, and also then too, clients should be encouraged to stay home if ill and reschedule appointments if necessary. If an ill owner enters the hospital, it's recommended that you ask the client to wear a face covering or put on a face covering, direct the client to an exam room, and then limit the number of veterinary staff that enter that room and clean and disinfect the room after the visit. To try and increase social distancing while still offering services, strategies like phone consultation, drop-off service, limiting the number of visits or clients in the hospital at any one time, or just having a service whereby people go directly into an exam room so that folks aren't collecting in the lobby, can be helpful, all in combination to increase social distancing. Also, in accordance with VDH recommendations, asking clients to wear masks and highlighting mask use among clients in general when keeping 6 feet apart is going to be difficult, such as in stores or other public places, can be another way that you can help decrease the likelihood of transmission in your hospitals. Next slide. Similarly with staff, employees should wear masks, as social distancing in a veterinary hospital is not always possible, but social distancing should be implemented when it is possible, such as alluding to some of the things I mentioned before, like social distancing during lunch or break times, or when performing administrative duties or animal care oriented duties where only one person is really necessary to do the task. It's also particularly important, it was throughout this pandemic, it's particularly important to keep in mind that some workers are at higher risk for severe illness from COVID-19, and those workers should be encouraged to self-identify to their employers as being vulnerable and see if strategies to be particularly diligent about that person's infection control measures can be implemented in the workplace. Employees should also be encouraged to stay home when ill and monitor themselves for illness prior to coming to work each day, including taking their temperatures. Ideally, and Dr. Darby alluded to this before, if workers are exposed to someone who's ill with COVID-19, they should self-quarantine for 14 days. For those working in areas considered critical infrastructure like animal health care, while self-quarantine is still ideal from a public health standpoint, there are allowances within CDC guidance to return to work during that quarantine time. Employers are encouraged to contact their local health departments if you're concerned about a COVID-19 exposure in the workplace or outbreaks in the workplace. And then finally, environmental cleaning and hand hygiene are also important in decreasing the viral load in the environment, and then which decreases the likelihood that SARS-CoV-2 exposure would come from hand-to-face contact. Next slide. I just wanted to offer a slide that has a list of resources, some of which are echoed by Dr. Darby. I also wanted to, even though doesn't really fit into under the umbrella of updated guidance, I wanted to mention the Compendium of Veterinary Standard Precautions. Standard precautions and infection control measures have been implemented in veterinary hospitals for years, and I never want to forget and always want to highlight the Veterinary Standard Precautions Compendium as a tried and true infection control guidance document that's been around for some time now. The other thing I'd like to mention is when it comes to assistance with, say, education of your employees and your clients, the Health Department COVID-19, the Virginia Department of Health COVID-19 website has quite a number of infographics that could be used as signage throughout your hospital, quick reference guides for staff and clients, so in order to remind everyone how important it is to take these measures, many of them both in the workplace and at home, because you would like to encourage good practices when employees leave the workspace. The workspace is often a bit more structured and more able to be controlled than the community setting, and encouraging good behaviors while both in the community and at work, I think is really important. Next slide. There were a lot of questions from veterinarians about PPE and PPE shortages, and actually what you're seeing here on the slide, a lot of it's pretty brand new. There's our Department of General Services now has a list of COVID-19 vendors for PPE. It's a list of over 300 vendors. The Amazon, Virginia now has and other states may as well, has an arrangement with Amazon Business, the details of which you can read about by connecting with that website. And then the Virginia Manufacturers Association has also partnered with Virginia businesses to create a website that serves as a clearinghouse for businesses seeking PPE. And so I would hope that folks could take advantage of those, check those out. If you're having trouble with shortages, you can connect with those websites and those vendors to help you out. It's also my understanding that more, and I'm happy, absolutely happy to hear from practitioners as a reality check on this. It's my understanding, based on what I'm hearing at the health department, that PPE in many instances is becoming more readily available all the time. So I would hope that this information would help when it comes to PPE supplies for you. And I think, I'm not sure. Oh, here we go. This is, I wasn't really going to be able to speak to this slide comprehensively, but a representative from the Virginia Board of Veterinary Medicine did want to pass this along for those licensed in Virginia. The Virginia Board of Veterinary Medicine is interfacing with veterinarians who have questions on a case-by-case basis. And so we do have, toward the end of the presentation, we have a list of, we have a directory, a list of folks you can contact for questions. And if anybody has any questions about the information you're seeing on this slide here, you can connect with the Virginia Board, information for which will be a little later in the program. And I think that might be all she wrote for me. Is that right?
Yeah, well, thank you for that, both Drs. Darby and Dr. Murphy, giving us an update and really new information on how to address some of the problems that have been coming up and that people have specifically posed to us in the survey. With that, we'll turn it over to Dr. Jenny Zambrisky, who will update us on some of the things that the veterinary teaching hospital here at the vet school is working on and some of the ways they've been addressing these questions.
Thank you, Dr. Hungerford. Hello, everyone. For those of you who don't know me, I'm an infectious disease epidemiologist at the College of Veterinary Medicine, and I am also an emergency doctor, so you may have referred a patient into me a time or two. And what I want to do is talk to you a little bit about how all of the things that Dr. Murphy and Dr. Darby have mentioned have been applied and implemented here in the College of Veterinary Medicine. And before we delve into the details of what we're doing, I wanted to take a minute and discuss with you some of the challenges that we initially faced in trying to develop a plan and a strategy and to implement policies and procedures. And I suspect that many of these challenges are universal and that you all are experiencing them as well. I would say that a lot of the information that Dr. Darby and Dr. Murphy have presented is information that we use to implement our strategies and plans and has been exceptionally helpful. When we initially started, the thing that was most frustrating for us was that there were not clear directives. There were lots of suggestions, lots of guidelines. AVMA had guidelines, CDC had guidelines, everybody had a guideline, but nobody had a directive. And that was largely because we just didn't have information to inform directives. And now we're finally getting to a point where we do have information and can make informed decisions. And so the situation is improving. And I think really that is best demonstrated by the Virginia Department of Health regional guidelines for veterinarians. It has taken a lot of some of the bigger picture concepts that CDC has presented and made them digestible and applicable for those of us here in the region. There specifically had been a dearth of information on practice guidelines that couldn't be observed. So of course, everybody is saying, please maintain physical distancing, 6 feet, 6 feet, 6 feet. But as you can see in the picture here, in our line of work, 6 feet isn't always possible. There's a lot of times when the responsibilities of our work requires us to be in close contact. And so it was very hard to find information on what was the best practice when you couldn't observe the best practice. And so again, working with Virginia Department of Health has really helped us to resolve some of these questions. Next slide, please. One of the other things that we came across as a possible issue, and that I think many practice owners will as well, were conflicts between employee health and HIPAA. What can we ask? Can we ask people to self-identify? If they choose not to self-identify, how do we respond in order to keep other employees and clients safe? Can we make a policy based on level of risk? Because if we make policies based on a risk level, does that then require people to self-identify who maybe don't want to? This was particularly tricky and is something that with improved guidelines and directives coming out has helped tremendously. We also were facing a problem of employees being hyper-focused on the use of PPE to the exclusion of other methods. And I think that Dr. Murphy really highlighted this best in the triangle that she just presented. PPE is just one tool in the toolbox. So how do you implement the other tools? How do you monitor? The nice thing about PPE and why people like it is because you can see it and say, this person isn't complying. We need to fix that. It's really hard to monitor hand washing and other preventative measures. Next slide, please. So I'd like to talk to you a little bit about the tools in the toolbox and how we are implementing them in the College of Veterinary Medicine. We basically have focused on 5 particular tools within the toolbox, and we came to this through a multifactorial approach, which involved reviewing guidelines from AVMA, CDC, WHO, the OIE, trying to align our guidelines with the AAVMC guidelines and with the policies and procedures of the Virginia Tech Carilion School of Medicine, as well as making sure that we were compliant with the Virginia Department of Health regional guidelines. So there was a lot of information to sort through and then to sift out and distill. We also reached out to infectious disease physicians, experts in their field, and asked for specific advice and oversight on some of these particular parameters. By and large, there was a lot of agreement across all of the sources that we went to. If there was any degree of variation, it was minor. One of the things that every source that we contacted recommended was some sort of daily attestation or affirmation of health. This, of course, varied from individuals signing a paper to simply coming in and making a statement. But regardless, there was a very strong belief that this needed to happen. And so this is something we are planning to include. Hand washing. Hand washing was something also that is tried and true. This is a tested preventative measure that we know works. But how do we oversee this? How do we implement it? We are going to put in measures that surround shifts and when you start and end your shifts, but also around the donning and doffing of gloves. While gloves are a wonderful piece of protective equipment, if you don't don and doff them correctly, you can actually make spread worse. And so hand washing before and after placing gloves is essential. We are, of course, going to use PPE. There were differing directives and recommendations on cloth masks versus surgical masks. And this is one of the areas where if there was a differing opinion, even if it was slight, what we've decided within the College of Medicine is to act in abundance of caution and take the approach that is perhaps slightly more restrictive. And so we're recommending cloth masks for our administrative positions, but surgical masks for those in clinical positions, simply because those positions require more close physical contact for the restraining of animals. And then, of course, the use of gloves for all close contact procedures. Next slide, please. Of course, we are going to work on maintaining physical distancing, but how do you do this when you have to be in close contact for certain procedures? Well, what we've done is we've thought a little bit about our stocking density, which is something veterinarians know a lot about. And we've gone and we've calculated the square footage of all of our working areas and tried to assess through mathematical formula how many people can realistically be in that room and attain 6 feet of distancing when possible, with the understanding that it's not always going to be a random distribution of people and that sometimes people will be closer than other times. But when you don't have to be close to one another, you should be in a room where it is still physically possible for you to maintain 6 feet of distance. We're going to try to facilitate this by hanging ceiling markers. I've actually already hung a disco ball at an observation point in the ICU, but I think it can be fun. You can hang other things from the ceiling as a suggestion of where to stand. If you aren't involved in a procedure, where should you be physically located in the room so that you're maximizing the distance between you and the next person. We're also going to post maximum occupancy restrictions on all of our rooms within the veterinary teaching hospital. And of course, we are going to continue to limit client contact and will be still working from the perspective of curbside drop-offs. We are working to implement attended euthanasias, and that will still require the client to wear a face covering in accordance with other regulations. Another consideration as well is individual level of risk tolerance. There is a real fear, and some people are more fearful than others. And I think it's important to recognize that these fears are real for everyone. And if someone wants to make their own choice to implement a higher level of control or risk mitigation for themselves, that's acceptable, provided that everyone in the environment is observing the required strategies. Thank you.
Thank you, Dr. Zimbrski. Just a reminder to people that if you're watching on the link, you can click on the YouTube at the bottom right of the screen, and that'll take you to YouTube, and you can type comments into the chat. The comments we've had so far have been questions that are going to be answered in the presentation. So if you have others, please add those. So with that, we'll turn to Dr. Tanya Leroy and Dr. Carrie Bissett, who will update us on what is being seen and reported in animals.
Hi, thank you, Dr. Hungerford. This is Dr. Leroy. I am the director of the diagnostic lab at Virginia Tech, or at Virginia, Maryland. And so what I wanted to do was just briefly go over what we know about SARS-CoV-2 in animals, because I think that helps to understand why we have recommendations for testing that we have. The cases in animals, what I'm focusing on are the ones that have been reported to the OIE, because they are confirmed by the appropriate regulatory agencies. So in dogs, what we have is a case in Hong Kong where 1 out of 2 dogs living with a COVID patient tested positive by PCR. They were able to identify neutralizing antibodies in this dog, but they were not able to isolate live virus. We have more evidence of cases in cats. There is 1 positive case each in Belgium, Spain, and Germany, and 2 positive cats in France. In the US, I know that you probably are aware, we have had positive cases in a tiger and a lion from the Bronx Zoo, and 2 cats were identified as positive from New York. These 4 cases were all confirmed by NBSL using PCR and sequencing. We also know of additional cases in mink farms in the Netherlands. And so overall, there have been less than a dozen cases that have been reported worldwide. Of the cases that were reported, the clinical signs associated with these were described as sneezing, ocular discharge, and coughing. And the tiger and the lion also had a dry cough, wheezing, and inappetence. But in no case was there evidence of pneumonia or respiratory distress. And all animals eventually recovered with supportive care. Is there evidence of zoonotic transmission? Well, yes, all of these cases were linked to contact with a sick person, a person with COVID-19, either in their household or a caretaker. There's currently no evidence, though, of animal to human spread or that animals play a role in the spread of the virus, either as a fomite. But again, as Dr. Murphy said, there are recommendations for appropriate infection control protocols for animals to limit the spread of other zoonotic pathogens, but also, as again, the evidence in this is changing or developing as we go. And so in the diagnostic lab, we're erring on the side of caution, but knowing that there have been no evidence of spread from animals to humans. And so the next slide, Dr. Bissett from the Virginia Department of Agriculture and Consumer Services is going to talk about the current recommendations for SARS-CoV-2 testing in animals.
Well, good evening, everybody. This is Carrie Bissett from the Virginia Department of Agriculture and Consumer Services in the State Veterinarian's Office. Just wanted to take a minute, and I'll be short, to talk about the current testing recommendations. The most important thing that I can say this evening is to say that we do not recommend routine testing for SARS-CoV-2 in animals for all of the reasons that Dr. Leroy just spelled out. We're not seeing that many cases compared to human cases. We think about it, we've had 1.5 million cases of COVID-19 in people in the United States and less than a handful of positive in domestic animals. So just the sheer volume or lack of sheer volume of positives that we're seeing in animals lends to the fact that this is an occasional spillover and certainly not a consistent mode of transmission. If you do have a case, and I'll talk about those considerations for testing in a minute, we recommend that you speak with myself or with Dr. Murphy or Dr. Darby at the Department of Health to talk about what you're seeing there in your practice that makes you concerned and feel the need that we need to potentially test for SARS-CoV-2. CDC released guidelines not too long ago that recommended what animals would be tested. So I'm just going to briefly go through those. Animals with a history of close contact with a person with suspected or confirmed COVID-19, animals in a high-risk environment, perhaps where a human outbreak has occurred, so maybe an animal in a nursing home, threatened, endangered, or otherwise imperiled or rare animals, such as a mustelid, the black-footed ferret, for example, that is a rare animal in the United States, and animals in mass care settings could be considered for testing if other factors are there, meaning that the animal has clinical signs and other more common diseases have been ruled out. So those are the sort of the considerations for testing and the criteria for testing that we would discuss with you. Certainly one of the most important things is to think, as we all remember back in veterinary school, to think about horses, not zebras in this particular instance. And so most commonly, we're going to see those routine, more common signs or causes of respiratory signs in our domestic animals. And rarely are we going to see SARS-CoV-2 in practice or even as a cause for clinical signs or symptoms in our domestic animals. The consequences of a positive test result. This SARS-CoV-2 is reportable to the World Organization of Animal Health, or the OIE. And so a positive test result through a private laboratory such as IDEXX or Antech is not a positive test result until it has been confirmed by the National Veterinary Services Laboratory in Ames, Iowa, which is the USDA's laboratory. And that's because this disease is reportable internationally in domestic animals. And so it has to be confirmed at that reference laboratory before we can move forward and call it a positive test result. If there is a positive test result on that rare occasion that there might be, we would work with the practice veterinarian to implement some sort of self-quarantine and working through the same sort of infection disease control measures that we use for people that we would use for animals as well, in terms of distancing that animal from other animals, distancing and limiting interaction with people, etc. And so with that, I will turn it over to the next speaker.
Thank you both for that information, and we'll continue our trend of talking about what the results are from animals with Dr. Cindy Driscoll from Maryland. We're close to the end of our time, and so we have 2 topics left, the wildlife and then some things on coping and wellness. So we hope you'll be able to stay with us, but if not, perhaps you can come back and catch the end of this later. So Dr. Driscoll.
Hi, as Laura said, this is Cindy Driscoll. I'm the Maryland State Wildlife Vet. Thanks for inviting me. I just have 2 slides, so it'll be really quick. And I just wanted to provide some resources and websites for you if you're interested in wildlife and how wildlife is part of the picture. Wildlife monitoring is always conducted in all states. And in our state, in Maryland, as well as Virginia, that means mostly morbidity and mortality response, and then research as well. We wildlife folks work with our departments of agriculture and health in our state agencies, but we also work closely with our federal agencies as well. And one of the ones that we work closely with, especially on bats, is the National Wildlife Health Center. And you can see at the very top of the box on the right is the website for that. The rest of the websites I think have already been touched on, the AVMA and the CDC sites. One of the things that you may not be aware of is the Zoonotic One Health Updates conference that happens once a month. And you can see that website there in the middle under CDC. Next slide. But just to be specific about bats, bats are really an important part of the ecosystem. And people forget that and think of them as kind of the villain sometimes, especially when it comes to rabies. We really don't know what is going on with bats in China, and that can be the horseshoe bat. And we don't think that there's any evidence of SARS-CoV-2 in US bats, so that's a good thing. Pangolins is another wild animal that has also been implicated in part of the picture, I guess. And that's in Asia as well. But we don't know, what we don't know is if there can be human to bat exposure. Everybody's worried about the other way around, but we in the wildlife world worry about whether humans doing field work or doing wildlife rehabilitation could infect bats and then cause a decline in bat population. So that's one of the things that's a big topic right now in our world. There's an infection study underway at the National Wildlife Health Center up in Madison, Wisconsin. And there's also a risk assessment study underway at USGS at the Patuxent Wildlife Research Center in Maryland. If you're interested in bats in your state or any kind of wildlife in your state, you can look at the 3 websites I've got listed here for Maryland, Virginia, and DC, and those are the wildlife agencies. And that's about all I wanted to say, and you can contact me if you have any questions about wildlife. Thanks, and I'll turn it over to the next person.
Thank you so much for those updates. And now we'll turn to Trish Hack and Dr. Nivedita Ravi Caldwell to talk about this other area that we had quite a few questions of how do we cope and assure the wellness of ourselves and those around us during this pandemic.
Thanks, Dr. Hungerford. So I'm a veterinary social worker, and I just want to recognize that everything is really tough right now. And I just also want to say, you know, you all have an amazing feat before you, and you're keeping everyone healthy and our food supply going. Kind of, you know, I've been thinking about the movie The Martian with Matt Damon recently. It's like we're trying to live on another planet and grow food without oxygen. It's pretty amazing. You know, he says one thing in the movie, it's everything is going to go south here, and you can either accept that or get to work. And I just want to say you all have gotten to work. It's amazing. I'm here to support your work. That's what veterinary social work is about, and to support your work with your clients. I have 3 main points. I'm going to go through 3 slides. And Dr. Ravi Caldwell, please jump in at any moment. Individual coping, community resilience, and I'm going to just touch on an article on healthcare worker needs to address anxiety from COVID-19. So psychological first aid was developed by the National Child Traumatic Stress Network, and they identified 5 evidence-based principles that we need to address following an event. And these are safety, calming, self and community efficacy, connectedness, and I can't emphasize hope enough. So these approaches that I've put in here, these prompts, these have come from my practice with clients that I have found helpful to help people, when we're in times of stress or traumatic situations, our ability to think and process is diminished. And so these are just some things that you can reflect on. And I think it's helpful to be intentional about that right now. Most importantly, I just want to say, take breaks, take breaks, take breaks. I can't emphasize that enough. There'll be a link that you can access a recent wellness webinar with more detailed information if you're interested. All right, we can move on to the next slide. So here we have our ability to name things is really effective in helping us integrate what's happening into our lives. We do compartmentalize to try to help us manage all these different new things, but these experiences that we're going through, we've got to be able to name them in order to talk about them. And our tool of communication is one of our greatest tools right now, especially with isolation. So, these experiences with COVID-19, changing information, the novelty, the isolation, this, lack of control and unpredictability, these are important things to name. I think you can kind of think about, I don't know, you could tell me, but if you have an infection, maybe it's similar to needing to identify what antibiotic you're going to use. So when we can name things, we really know what direction we can go in. So when we know what we're dealing with, we want to build community resilience. And that depends not just on resilient individuals, but it depends on our deliberate, meaningful interactions in our communication. And this book on crucial conversations, Stephen Covey wrote the foreword, and he's sold millions of copies of his 7 Habits of Highly Effective People. Basically, it's really helpful in how to have these difficult conversations. So I recommend it. And you can find a brief synopsis on this book at the AAVMC Wellbeing website. All right, we can go on to the last slide. So crucial conversations are really about establishing safety and mutual understanding. So it's about having a dialogue, and the dialogue is really where we have the power to affect change. And this seems really relevant considering the results of the survey that we reviewed at the beginning of this webinar. And it's also echoed in the results of this recent JAMA article. This was just published recently. There were focus groups conducted with healthcare workers in human medicine around anxiety related to COVID-19. And the gist is that we need to feel heard and supported. And they talked about key components of response to the extent that we're able, and that really boils down to an atmosphere that supports dialogue. And so I just want to acknowledge, though, that practices likely can't respond in all the ways that are outlined. There's a more detailed table in the paper if you check it out. But the take-home message is how we respond, even if it's just acknowledging. It benefits not just the individuals, but the whole community. So I've compiled some resources at the Virginia Tech Veterinary Social Work website. There's a link there for you, and I continue to compile more. And there's also a form there where you can submit any resources that we would upload. And I just wanted to also answer a couple questions that were submitted in the survey as my last point. The American Veterinary Medical Foundation has some grants, I think, that were recently shared through an email to the listserv, your AVMA listserv. And I think those are some financial resources that may be new. Dr. Ravi Caldwell can maybe speak a little more on that. And partial unemployment benefits do exist. I don't know if folks are aware of that, but you can contact your local Employment Security Commission to learn more about that. Thank you so much.
Thank you so much. Hopefully everyone can hear me. My name is Nivedita Ravi Caldwell. I am a veterinarian as well as DC's zoonotic disease epidemiologist. I just want to quickly say my experience, my personal experience. I've practiced as a companion animal veterinarian in private as well as corporate settings. And from personal experience, I have found strength in an affirmation in sharing my vulnerabilities with my colleagues. So very similar to what Dr. Hack said, you know, I took the first step in opening up with my colleagues, and I found that many people were experiencing the same emotions that I was. And I also found strength in becoming involved in the American Public Health Association's Veterinary Public Health Group. And, you know, mental health was an issue in our profession long before this new reality set in. So we need to not only improve our individual resilience, but also make sure that the well-being of our colleagues is also a priority. By engaging in this sort of mindset where we seek to be of service to others in need, we will find common ground and healing. So if you're interested in getting involved and being a voice of change on a national platform, please do email or call me. If you simply want to talk, I'm very approachable, so do that too. I serve on a newly formed suicide working group at APHA and would love to increase the veterinary representation in the national discourse around mental health in the healthcare profession. So thank you so much for your patience and attention during this webinar.
So thank you both for ending us on that note of this very important topic of how we can support each other and our coworkers and the others around us, to bring us full circle from talking about the different kinds of measures we need to take and the different stressors of this pandemic. With that, we're going to take a moment for a word from our dean, now that we have his sound fixed on his end.
Thank you, Laura. I'm joined here this evening with our new incoming dean, Dr. Dan Gibbons, who will be taking over on June 1st. We would like to thank our colleagues from the Commonwealth of Virginia and the states of Maryland, West Virginia, and the District of Columbia for joining with us this evening. As the Virginia-Maryland College of Veterinary Medicine, we appreciate and value the partnership that we share with the state officials from our associated states and the District of Columbia. And so we thank them for joining us this evening and participating in this very useful information. We've all been challenged with this pandemic, and it is encouraging to see that during times of crisis, we come together as a community and support each other. That has been self-evident this evening. So I hope you have found this information helpful, and you have now a listing of people and resources to help you and help finding answers to your questions. And so we thank all of you all for joining us this evening.
So thank you, everyone, as our dean expressed, for joining us tonight. Thank you for the work that you're doing to continue to serve animals, clients, coworkers, and communities in these really difficult times. Thank you all for submitting those questions to us. We incorporated as many of them as we could into the presentation, but we do have contact information here for you to continue to follow up and ask specific questions or get more detailed information on some of the things that our presenters gave you information on. And then we also have immense gratitude to our outstanding panelists who came together, looked at your questions, prepared this information to share with you, and are willing to continue in a dialogue as you have more questions. And also for all the things that they are each individually doing to combat disease and to support the health and well-being of animals and the people who serve them. So thank you so much for joining us tonight. Good night and stay safe.